There's a dire shortage of ambulances around the country. A Bhekisisa survey has found that just under 2,000 state-run ambulances are on the roads. This means that many patients in need of emergency treatment just don't get it. Let's chat more about this now and what you can do if you're affected. We chat to Senior Associate at DSC Attorneys, Johan Roo. He's in Cape Town for us this morning. Johan, good morning. And you are dealing, I understand, with cases of people who've been affected by this. Firstly, let's talk about what is happening out there. What have you found in your research, in your investigations, as to what is happening with ambulances and emergency services out there and how it's affecting patients?
Yeah, we get quite a few inquiries with people coming to us and saying that either them or a family member had a dire emergency, and that even though they called an ambulance, sometimes the ambulance never even arrived, or it arrived many hours too late. And then a consequence of that would then be that the people sustained a very severe injury which would otherwise have been avoided if the ambulance had been on time. So we certainly see evidence of the shortage, and we also see the dire consequences of that.
So are we seeing, when we talk of the crisis, are we seeing a shortage of vehicles? Are we seeing a decrease or a drop in the number of vehicles that attend, that they are there, but they're afraid to go to certain areas or certain scenes for whatever reasons? And recently we've been seeing attacks on paramedics and things like that. Would those be contributing factors to this, or just that there aren't enough vehicles? What is it?
I think it's a combination of many things. Definitely a shortage of vehicles is the main problem, but you also, certain ambulances are better equipped than others. So you also get quite a few instances where the wrong ambulance gets sent out. And as you correctly point out, there's this crisis with the attacks on the ambulances, which also has definitely had a huge impact on the service delivery.
Okay, so obviously it is impacting a lot of people out there. They are coming to the likes of yourselves and probably other attorneys as well to see what they can do. And I'm looking at cases here for women who lost her baby because there was no ambulance there that didn't arrive to help her. Lots of other cases as well, Johan. So what do you do? Who do you hold responsible for this? Do you hold those drivers sometimes, like you say, many factors, who are too scared to go to a certain area because they've been attacked there before? Is it the Department of Health? Who do we actually go after in this case?
If it was a public service delivery, you'd go after the health department in that specific province. You'd never go against the actual ambulance driver. And in other cases, you'd get private companies who operate the ambulances. In that case, you would then investigate a potential claim against that private company.
So if somebody were to take legal action, what are the things they would need for their case? What kind of proof would you need? Where would you ask them to even start?
We would do a very comprehensive investigation into the incident. Firstly, look at telephone records to see exactly when requests were made. And then the ambulances, they usually keep very detailed records of exactly when they were called, when the vehicle was dispatched, when the vehicle eventually arrived on the scene. So we look at all of that very carefully and then determine if it was reasonable in the circumstances or not.
Okay, and where are you seeing if you've managed to investigate this, where are you seeing the most number of instances or the biggest impact of what's happening with these services? Which provinces?
It's difficult to pinpoint a province, but one thing I can say is that the rural people are usually affected the worst. The most tragic cases of severe disability and death happens in the rural areas, and it's like in the example that you mentioned earlier, the lady who lost her baby, is that the ambulance arrives 8-10 hours later, or sometimes never even arrives. And so the rural areas are definitely affected the worst.
All right, and what success have you had in dealing with such cases and getting compensation for those who've been affected?
Yeah, we've had quite a few tragic cases, matters that come to mind of people where the medical experts would say to you, if this person had received treatment at an appropriate hospital earlier, would not have had severe brain damage or death. So we've had quite a few of those matters that we've dealt with successfully.
Okay, so just a very quick how-to for us, Johan, for anybody who wants to institute a claim or take up a case, or where would they begin? You go to a police station and lay a charge, or come straight to an attorney?
I think the best step is contact an attorney first who does specialize in medical negligence type cases. And we'd be able to guide you exactly what we need from you and also then advise you what would be the appropriate steps to take further.
All right, thanks very much for that advice. Johan Roux, he's from DSC Attorneys. They've been dealing with cases where people are claiming because of the lack of action or inaction by emergency services and ambulances simply not arriving or arriving too late to save a life when they could have. So now you know what you have to do if you're a victim there.